Hello, everyone. Happy Friday. Seems like it's taken us a long time to get here this week, but here we are. I'm Rendi Murphree, epidemiologist and director of disease surveillance at the Mobile County Health Department. Here to check in with you. Hope you all weathered the storm and are recovering nicely, cleaning up, and that sort of thing. We're here to give you the update of the COVID pandemic on Mobile County, our residents, our businesses, our visitors. So I'll start as we normally do on Friday with some worldwide numbers. So worldwide, more than 45 million cases of COVID-19 with almost 1.2 million deaths. In the U.S., there have been nearly 9 million cases of COVID-19 with 229,000 deaths. We still lead the world in the number of cases and deaths. India has just about 1 million fewer cases than we do, but we have almost twice the number of deaths than in India. So they have many fewer deaths. And again, Brazil continues to be in third place worldwide. In Alabama this morning, reporting on 190,496 cases with 2,932 deaths. So today for Mobile County on our daily COVID report that's done in partnership with SSI Group, we're reporting on 17,225 cases of COVID-19. Yesterday, 90 cases were added. Wednesday, 67 cases. Tuesday, 72 cases. And on Monday, as I reported Monday afternoon, we had just 22 cases reported on Monday. So normally we do see sort of an increasing number of cases as we move through the week because many places are closed on Saturday and Sunday. So again, 90 cases added yesterday. We have a total of 321 who have died with COVID. Just one additional death was added since yesterday. Hospitalizations are up 13 from yesterday. Now the cumulative number of COVID-19 hospitalizations is at 2,275. And the number currently hospitalized is continuing to creep up, which is concerning to us. So yesterday, there were 83 people hospitalized with COVID-19. That was an increase of 3. So we had been sort of staying down in the low 70s, but the last couple of days, the number of patients hospitalized has risen into the higher 70s. And we've had now a number in the low 80s yesterday and today. Today's number is 83. So again, those of you that are at risk of severe illness, complications, and death, we really, if you are older, if you have underlying medical conditions, if you have underlying medical conditions of any age, and then people who are older or who are obese are at higher risk of severe illness, complications, and death from COVID. So those are the populations that we need to protect. Those folks should stay home to the greatest extent possible. Have a family member or friend run your errands, and certainly stay out of crowded spaces. But everyone has to do their part to slow the spread of COVID in the community. Even young people, so folks in high school, young adults in college, or young working adults, you guys are out there, potentially spreading COVID and not knowing it if you have infection that where you don't have any symptoms or you have very mild symptoms. So that's why we need all of you to wear your mask, wash your hands, stay at home if you're sick, cover your cough, disinfect surfaces, all those things that we need to do. It's our community's responsibility, all of us, not just the ones that are at greatest risk, but everyone's responsibility to try to protect our community from COVID. Our risk indicator this week at the week ending, it's updated on Friday. So the data lagged behind by about a week, but Mobile is in the moderate risk category with the latest update today. Last week we were in very high risk, so seems like some things get better, some things get worse. So let's keep an eye on it and just try to keep the numbers low, try to keep the hospitalizations low so that we can protect those most vulnerable community members. The number of complaints that we have been receiving has gone down over time, but remember, If you know about an outbreak, or if you have a complaint against a business, or if you think someone is not interpreting the guidelines properly, you can send an email to iscomplaints@mchd.org or to covid19@mchd.org. We continue to consult with businesses, with schools, with daycares, with restaurants, hospitals, nursing homes. We still continue to consult with those folks to help them, interpret guidelines, make decisions about what to do if you have an employee or a resident or customer who's COVID positive, those sorts of things. So we have those calls all day, all week. So don't hesitate to reach out to us if we can be of assistance. Right, there are a few questions, and then I just have a couple other announcements. So lots of questions about Halloween. I'll get to that in a minute. But someone asking about the concept of a super spreader. What is a super spreader? And so this word, I think, has been taken a little bit out of context. We talk about some other diseases. Let's say, for example, tuberculosis, where someone, maybe because of their immune system or their lungs, or they, instead of sort of just normally talking and shedding virus or bacteria or something of that nature, that they seem to expel a lot more of those agents than a normal person. Sometimes it has to do with projection. So we know around like singing and shouting, that sometimes can create a situation where an individual is spreading infection at a much higher rate than they would when they were normally talking. You may, like I said, just based on the biology of your body, infect many more people than someone else who's got the disease. But I think in the context of COVID, what we're really talking about are super spreader events, where you have someone who has COVID who is around a lot of people, not necessarily more infectious, but because they're around crowds or around a lot of people, a lot more people get infected than would if the person was just, following the guidelines to stay at home and not gather, not attend large gatherings. So think of it as a super spreader event where you have people gathering from different households, from different locations, in the same space, not physical distancing, not all wearing masks. And it creates a situation where you could have a lot of transmission during one event. And traditionally, we would call that an outbreak. So this super spreader concept, again, is just think of it as a lot of people exposed from one sort of event or one person. All right. A comment here about COVID fatigue. Mobile County has been in the COVID outbreak world now for many, many, many months. Our first case was reported on March 19th. Here we're now at the end of October. And we're all tired of being told to wear a mask and to wash our hands and to stay at home. We're tired of, businesses opening and closing because they maybe have a COVID event and our favorite restaurant has to shut down for some period of time. Tired of schools, not operating normally. Just so many things in our lives are different, and it can wear on you after a while. So this is not the time to become complacent. Yes, we had to deal with Zeta this week. So we had another disaster within a disaster week, but we have to remain vigilant about slowing the spread of COVID until we have more treatment and until we have a vaccine that can help protect us. Because right now, all we have is physical distancing, disinfection, and wearing a face covering. Some Facebook questions asking if we use social media tools to detect outbreaks and spikes. Sort of, yes, we pick up some complaints sometimes on social media and follow through and investigate those. But I think the way social media has really helped us is that lots of folks call us because they have heard us say on Facebook Live or on our, when the recordings are viewed, or just getting news releases out or talking to the media, that you can contact us if you want to report something or if you have a question. So we are very happy to continue doing that, and we do hear a lot from our community, and that I think is because we've socialized those email addresses, and we've hopefully built trust with the community, and that you can call us to talk to us, and we will do our best to provide good advice and guidance. Someone asking on Facebook about, do we have any idea about the volume of unreported tests? And we don't. I think even CDC is trying to wrap their heads around how many tests are not reported. It's a situation of you don't know what you don't know. And the federal government, the state health department, and we are all working on our different levels to try to get an idea, wrap our heads around how many test results are out we should expect, and try to work with the manufacturers of these different types of tests to try to get information on the outcome of those tests and who is being tested. But like, for example, we do know that the federal government sent something like, 1.5 million ID Buy Next Now test kit to the state of Alabama for distribution. Many of those went to schools, some to Department of Corrections, many to nursing homes. Health departments got some. So, we know that denominator is out there, but we don't know if they're being used or if the people using them are reporting those. So it's not a comfortable situation for people like me that really like to know how many tests are being conducted and how many of those are positive. And then someone was commenting on the weekly report that we put out. Maybe it's better to talk about this on Monday, but I think that the comment was more about they found a lot of value out of our daily reports where we say, this is how many cases was added yesterday, this is how many deaths was added yesterday. But this Facebook viewer didn't see the value in the weekly reports that we put out. But we'll continue pushing those out because many people do find value and look to see that more longitudinal information. Okay, a couple other things. Flu season is here, so please get vaccinated early if possible. I'm just looking at the flu report. Right now, the percentage of outpatient visits attributed to influenza-like illness in Mobile is 1.13%. This year's threshold for sort of, epidemic baseline is 3.29%, so we will continue watching that. But just to remind you, the flu vaccine will not protect you from COVID. It will provide protection from influenza. They have some similarities, so please get your flu shot early. All right, and now to Halloween. So tomorrow is Halloween, and I think the moon is either going to be full or almost full. So what a glorious confluence of events. And Trick or Treat is on Saturday this year, so that's amazing. Thanks to the leap year, most all of our holidays are on a weekend this year, or on Friday, so that's super, super nice. So just some things about trick-or-treating just to try to, slow the spread in our community because, according to CDC, traditional trick-or-treating is considered a higher risk activity, and we want you to try to do some things to lower the risk of COVID transmission while you're trick-or-treating. So participating in one directional trick-or-treating, so keeping trick-or-treaters from passing in this direction, right? Just all go down one direction. Lining up individually wrapped treats so that they can just be picked up, by children and put in their bag. I've seen on social media some rather ingenious apparatus for delivering a piece of candy, dropping a piece of candy using a pole or some sort of extension. If you are not able to line individually wrapped specimens up and you are going to answer your door, please, if you have an underlying medical condition, if you are older, if you're at high risk for complication, if you're in isolation or quarantine for COVID exposure, please do not open your door. Stay inside. But if you are a healthy adult and you decide to deliver candy by opening your door, please have an adult with a mask on place an individually wrapped candy in the trick or treat. You know, for each child. Don't let kids put their hands in the candy bowls. Parents, take hand sanitizers with you and sanitize children's hands frequently. We know they all like to sort of touch and hug and hold hands and high five and those sorts of things. Don't pass out any homemade treats of any kind. Again, wear a face covering, everyone except for children 2 or younger. But a costume mask does not count as a mask to protect you from COVID. You need to be wearing a facial covering. So we don't want you wearing a facial covering and a Halloween mask. That could restrict your breathing. So please just go with a face covering this year. Maybe paint your face, wear a hat to go with your costume. But a Halloween mask is not an adequate substitute for a face covering. Let's see. Let me make sure I haven't hit anything. If you are going to have a gathering, then it should be held outdoors. It should be for a shorter period of time than normal, and it should be with fewer people than normal. So outdoors is better, shorter is better, fewer people is better to try to have everyone wear their mask and be able to physical distance. Also, if you're inviting people to your house or to a gathering, make sure that you let your expectation be known in advance that everyone attending must wear a mask. And consider some other things like, drive-by costume show off or decorate your cars or, walk around with your children to look at the decorations, but don't go up to people's doors, those sorts of things this year. And then a really great alternative, this will be the last thing for today, is the drive-through trunk or treat event that's sponsored by Mobile Parks and Recreation. It's tomorrow from 10 a.m. to noon at Langham Park. Treats for the kids. They're having a decorated car contest. Children must be in a vehicle and ages 13 and under, please. Masks are required. So if you are spooked by COVID this year, then a good alternative is to participate in this fun activity with Mobile Parks and Recreation and probably 10 other partners, including the Mobile County Health Department. People would be dressed up, you can drive through, there'll be lots of treats, and don't forget masks are required and stay in your car. So with that, we'll end today.
Did we get the media questions?
Yeah, okay. Yeah, because they were about Halloween. Monday, we will be talking to you about COVID safety while voting and how to stay safe at polling stations. So more to come on that. The bottom line is wear a mask. All right, I think that's it for today. So we'll talk to you on Monday. Be safe out there, everyone.